Okay, so thanks for coming out tonight. I I'm really glad to present this because um, you know most people don't know what functional medicine is. So why would you choose functional medicine? So we're going to talk about that tonight and many other different things. So to start, we'd like to take a moment to discuss current conventional practices. The National Institutes of Health defines conventional medicine as a system in which medical doctors or other healthcare professionals treat symptoms and diseases using drugs, radiation, or surgery. That's their definition. So let's take a look at some of the similarities between conventional and functional medicine. Both practiced by licensed medical professionals. Both are evidence-based, and both utilize diagnostic testing. So conventional medicine is extremely effective for treating acute problems such as a heart attack, bone breaks, or physical trauma. While conventional medicine is a good tool for many things, functional medicine is built on the technological advances made in conventional medicine. So, unlike conventional medicine, functional medicine focuses on identifying and addressing the root cause of disease, not just symptom treatment. Functional medicine examines every factor involved, including symptoms, genes, environment, and living lifestyle factors to treat the causes of the disease, not just the symptoms. Functional medicine was developed based on the understanding of the importance of an individualized approach to disease causes based on evolving research in nutritional science, genomics, and epigenetics, according to the Institution of Functional Medicine. So at the heart of functional medicine lies the understanding that when the underlying causes are not addressed, problems can progress and worsen. Lifestyle factors such as your diet and stress often are the consequentially they lead to irritating, chronic, and painful medical conditions. The body is well equipped to heal itself. However, a poor diet and excessive external stresses interfere with the body's ability to heal naturally. So the following factors are what truly set functional medicine apart from conventional. Okay, so functional medicine looks at we just said this, the cause of the treatment. I'm sorry, the cause of the problem, not the symptom. Holistic view of the entire body rather than a collection of separate systems, okay? It examines the body, the mind, and the spirit connections to determine both physical and emotional aspects of disease, and it improves the body's innate healing ability, because that's all your body knows what to do, is to heal. So as we just discussed, the goal of functional medicine is to determine the root cause of an illness or disease in order to treat the cause of the symptoms. Functional medicine uses the symptoms as a clue to discover something hidden deeper. Picture a tall oak and imagine what we see above the ground as the symptoms of your disease. The extensive root system below the ground is less visible, but less important. The roots symbolize, but no less important, and actually is very much more important. So the root symbolizes the cause of the disease, and the functional medicine takes into account both the seen and unseen systems of the body in order to understand how that everything works together. So when it comes to chronic conditions, a system-based approach is needed, but this can be a time-consuming process. which is why functional medicine is the preferred approach by a growing number of medical professions. So functional medicine is a personalized healthcare treatment to treat individuals, not diseases. Each of us are genetically and biochemically unique. Functional medicine supports the body's natural ability to heal rather than tackling disease directly. Research shows disease and illness is composed of a complicated network among various systems of the body. Functional medicine utilizes this science to understand the relationship among these functions and to help the body self-regulate and heal. Tapping into this natural ability promotes natural healing and even prevention of many diseases. Did you know that health is defined by the World Health Organization as a state of complete physical, mental, and social well-being, and not merely the absence of disease? Functional medicine has been proven to help a wide range of conditions, including cardiometabolic conditions such as diabetes, high blood pressure, and heart disease, neurological and psychiatric conditions such as depression, attention deficit disorder, and migraine headaches, digestive disorders such as irritable bowel syndrome, ulcers, chronic pancreatitis, acid reflux, or diverticulitis, autoimmune diseases such as rheumatoid arthritis, lupus, and celiac disease, skin disorders such as psoriasis, acne, and eczema, and hormonal problems such as thyroid conditions, chronic fatigue, and menopause, and those are just to name a few. The main goal is to repair and restore the body's natural ability to heal by restoring system balance. Since each of us is different, our care plans are unique. Care plans may include lifestyle changes such as diet and exercise, stress management tools, detoxification programs, nutritional supplements, botanical remedies, or in some cases, prescription medications, although we really try to avoid those. Each plan developed between a patient and a functional medicine health professional aims to restore imbalances causing a specific condition and prevent chronic conditions from occurring in the first place. A study published in the Journal of Health Economics entitled "The Value of Disease Prevention versus Treatment" found that the demand value of prevention always exceeds that of the treatments. Disease prevention is the process by which anticipatory actions can be taken to reduce risk factors known to lead to specific conditions. Millions of individuals die each year from preventable diseases, including heart disease and cancers, chronic respiratory diseases, strokes, and diabetes. So a study published in the Archives of Internal Medicine reports significant results for participants following a combination of 4 different lifestyle changes. The study followed 23,000 participants adhering to 4 behaviors, and those behaviors were not smoking, exercising 3.5 hours a week, eating a healthy diet, and maintaining a healthy weight. So these behaviors alone attributed to 93% diabetes prevention, 81% heart attack prevention, 50% stroke prevention, and 36% cancer prevention. A study published by The Lancet followed 30,000 participants across 52 countries. Similar results were reported with 90% prevention rate of all heart disease with lifestyle changes. Note that these are just two examples of an ever-growing body of research on lifestyle changes and disease prevention. There are many factors contributing to heart disease. While genetics contribute to some degree, many factors are within our control. According to Dr. Hyman, genetics load the gun, but environment pulls the trigger. So aspects such as high blood pressure, high blood sugar, and abnormal cholesterol are contributing factors to heart disease. They are often treated with medication. However, Hyman reports studies have increasingly shown that treating these risk factors has only little benefit or none at all. So lifestyle changes are the most effective tool in preventing contributing factors, thus significantly reducing the risk of heart disease. So a note on medications. While medications certainly have a place, a study in the Nutrition Journal compared treatment with statin drugs to a diet rich in viscous fibers, almonds, soy, and plant sterols with the lowering of cholesterol. The study found similar rates of cholesterol reduction. However, the dietary changes also reduced inflammation and homocysteine levels. Now, please note that those two factors are not the only thing that cause heart disease. You should go and look at Dr. Roberts' coffee chat from last weekend where he discussed I believe 10 of the conditions that cause heart disease, and there's many more after that. So functional medicine utilizes the following modifications for preventing and reversing heart diseases in some cases. Number one, eat your phytonutrients. Try getting 8 to 10 servings of very colorful fruits and vegetables to maximize the disease-fighting benefits of vitamins, minerals, fiber, antioxidants, and anti-inflammatory molecules. And I'm talking like carrots and berries, things like that. Number two, stabilize blood sugar by incorporating small amounts of protein, healthy fat, and healthy carbohydrates in every meal. Get more fiber. The average American adult is only getting 15 grams of fiber per day. Work your way up to about 50 grams by incorporating high fiber foods such as vegetables, nuts, seeds, and like very non-genetically modified whole grains, particularly einkorn. If you don't know what einkorn is, you should reach out to me. Number four, ever wonder why processed foods have such a long shelf life? Processed foods are packed with all sorts of chemicals and dyes and are lacking any essential nutrients. And number five, eliminate foods with hydrogenated fat, such as margarine, shortening, or processed oils. And many baked goods and processed foods like cookies and crackers. Instead, opt for foods that are healthy in omega-3 fatty acids. Anxiety is a normal part of life. However, when anxiety doesn't go away, it can interfere with your daily life. Conventional medicine approaches anxiety by balancing neurotransmitters in the brain. Functional medicine takes a look at the root cause of the anxiety. Let's discuss a gut pathology contributing to anxiety your functional medicine doctor may examine. So instead of suppressing symptoms through prescription medication, functional medicine examines the underlying causes. Even if anxiety is caused by any imbalances in the neurotransmitter activity, what is the cause of the neurotransmitter dysfunction? Why? Why is that happening? A functional medicine doctor may start by examining gut health. The body of evidence linking gut health and brain health have skyrocketed. In fact, research on this link goes back to the early 1920s. Gut inflammation, small intestinal bacterial overgrowth, and fungal overgrowth, among other issues, affect the brain. Additionally, serotonin, a key neurotransmitter, is produced in much higher volume in the gut than in the brain. Some doctors even argue that the gut is our second brain. It's recognized that dysfunctions in the gut can lead to a variety of cognitive, mood, and behavioral disorders, including depression. The link between nutrient deficiencies and disease cannot be overlooked. Your functional medicine doctor will most likely want lab work on your blood and urine nutrients to determine if any of those are low. B12, folate, zinc, copper, EPA, DHA, vitamin D, B6, and riboflavin all play an important role in your mental health and your neurotransmitter activity. Shellfish and organ meats are the highest in many of these nutrients listed. Cortisol is noted as a potent stress hormone and has been associated as a major contributor to a number of chronic conditions. While cortisol plays an essential role in circulatory function, excess levels can be deadly. Many studies have examined the relationship between stress and health, and the results are alarming. Some well-documented negative health results of stress include damage to your immune system, increased risk of diabetes and obesity, and poor cognitive function and focus. Our skin is the largest and most viable organ of the body. Did you know that your skin can reflect deeper issues to your health? One of the most common chronic skin conditions is eczema. This is an inflammatory skin disorder that results in red, dry, and itchy skin. Dermatitis is an acute skin condition with similar symptoms. Skin infections, on the other hand, can be caused by a virus, bacteria, or fungus. Some forms of viral conditions include herpes, shingles, and warts. Bacterial infections can spread to all parts of the body, such as cellulitis. Athlete's foot and ringworm are examples of fungal skin infections. Antibiotics are commonly used to treat infections. However, they can weaken the immune system and lead to chronic conditions when inappropriately used. Thus, treating the skin condition from the inside out is necessary to address the root of the problem. Cortisol is noted as a potent stress hormone and has been associated as a major contributor to the number of chronic conditions. While cortisol plays an essential role in circulatory function, excess levels can be deadly. Many studies have examined the relationship between stress and health, and the results are alarming. Some well-documented negative health results of stress include, again, damage to the immune system, increased diabetes and obesity, poor cognitive function and focus. Functional medicine can help through various outlets, first and foremost by addressing the underlying cause of the stress. Diet, exercise, and relaxation techniques will also be employed. The body already houses a number of detox methods. Through functional medicine, you can aid this natural detoxification process. The liver, for example, is a major organ of detoxification. When the system becomes overloaded with toxic agents, they can accumulate and get trapped in the body. The purpose of a detox program is to reduce the burden of being overactive from the liver and the digestive system by allowing it time, anywhere from a week to a month, to rest so it can once again function optimally. Additionally, it is important to support the detoxification pathways with the proper and necessary vitamins, minerals, and micronutrients. Your functional medicine practitioner can help you determine foods to avoid which cause excess inflammation in the body. Many patients wonder if they can get all the nutrients needed from diet alone. Ideally, food would provide everything we need. However, there are several factors causing diet alone to not be enough. For example, depleted soils, the storage and transportation of food, and genetic alterations all impact the nutrient content of everything that we eat. Examples of conditions requiring additional supplementation include obesity and diabetes. Both conditions are results of malnutrition. Essential vitamins and minerals are needed to restore the balance in the body's functions. Specific supplementation measures will be discussed between you and your functional medicine practitioner, depending on your current state of health and your health care goals. Supplementation programs will differ. This will be a wonderful thing about functional medicine. There is no one-size-fits-all approach. Every level of care is developed specifically for you and you alone. So when visiting a functional medicine practitioner, you can expect your visit to take a bit more time than it would with a conventional practitioner. Functional medicine practitioners are looking for in-depth information regarding your personal and family history and the circumstances around your first symptoms. As the goal is to uncover your underlying causes of your health problems, a detailed history, physical examination, and laboratory testing are necessary to provide a full picture. This may seem like an initial investment, but it is worth the time to get to the cause rather than treating the symptoms, which can lead to recurrent conditions. The Institute of Functional Medicine suggests a list of questions to ask your practitioner to get the most out of your experience. Remember, functional medicine requires you to be an active participant in the problem-solving process. So here's some questions. How would you describe your practice? Do you work with other clinicians, such as nutrition professionals, health coaches, etc.? Do you have information that you could send me about your practice? Do you have experience treating my condition? What are the main therapies that you use, such as dietary, chiropractic, supplements, stress management, things like that? Make sure that you ask all those questions. So thanks so much for joining tonight as we discussed why you should choose functional medicine. Hopefully it was a lot of information that you found very informative, and I'm going to open the floor up for questions if there's any.